We have these non-face-to-face services like the telephonic service and the online services. You remember, like, telephonic services can be done by the physician as well as the non-physician healthcare providers. For physician, we will find it in the E&M section. That's the evaluation and management chapter of the CPT manual. So for non-physician practitioners, these are included here. So the same guidelines appear, like where the patient should not come to the office within the next 24 hours, or the patient should not be there in the global postoperative period, and there should be at least 7 days passed away from the previous therapeutic or the visit from the doctor's office. In that case, you can bill the telephonic services. Please understand that Medicare may not reimburse the online services, but due to COVID, there were so many changes that were taking place, and Medicare has started to reimburse such non-face-to-face services as well. So we have these online services via internet, which is being reported, or the patient has been seen by the non-physician practitioner. We have certain miscellaneous services like this after-hours services, which can be reported like CPT 99051. Here you should understand, why sometimes doctors report these extra services like, conveyance of specimen or handling of specimen and all that, because they feel that they can certainly charge for these services because there is some amount of effort that is being spent. Say when you are going to report CPT 99051, which means it is an after-hours service. So what happens here is, it's a scheduled after-hour. Say after like 5 o'clock or 6 o'clock, there will be like limited staff. But still, the physician has to manage this particular patient. So he wants to charge them extra. Okay. So 99051, it is a regularly scheduled after hours. Whereas 99050 would be on an unscheduled holidays, where if the doctor is seeing a patient on an unscheduled or on holidays, you can bill that. If the physician is going to do a service on an emergency basis in the office, you can report that. Or if the physician is seeing the patient out of the office, due to some emergency on the road, he is going to assist and help, which is disturbing his usual activities, we have special codes for them. So you can add them as extra. Sometimes insurance reimburse, sometimes it may not.